You were telling about a special case of a young man who was kicked by a horse.
Oh yes, while the team was here, there was that unfortunate incident. A young man won a bet, was celebrating. The kick had apparently ruptured some organs internally. That is the spleen, for example, and the pancreas got damaged. That is a life-threatening condition.
October 24, time for us to welcome you to another program of Guyana Today, hoping that you will rise and shine with us. Good morning, I'm Anadi Holodar.
I'm Savannah. Currently in Guyana, there's a 21-member team coming in from Doctors International to do some special surgeries, more specifically in the area of urology and some others.
And we've been doing about 5 to 6 cases per day at Georgetown, and the general surgery team has been working at West Demerara doing a similar number of cases. We've been tackling...
Guyana is the only English-speaking country in South America, with 83,000 square miles and a population of just about 750,000. It's estimated that 80% of the population of Guyana lives along the coastal belt and along the banks of the main rivers.
Guyana as a developing country has always been a bit lacking in some of the critical human resources. The average here for Guyana for doctors is about 9 per 10,000 population. So we just have about 1/4 of the doctors that are required to deliver the type and quality of service that is needed by the population.
When it comes to specializing, we've got some limitations.
In the past, like myself, we've had to go abroad, get trained, and that's where the problem lies. No one returns.
Because as soon as they acquire these special skills, there's usually a big market out there in the rest of the world, and quickly they are taken up.
We've got a large urological burden of disease. I'd love to give as much back to Guyana as I've got from Guyana.
Because we want to take this tube out, all right? Yeah. It might be a little bit more comfortable with this without the
I'm a cane farmer. I plant the cane and sell it to the estate. The work is really strainful. 100 pounds or something fetch up on your head all day, up and down, up and down. I work hard to get meals for my family, very hard. If you ain't work, you wouldn't get paid. But that's the only resource we got around here. Most people is cane. Cane, everybody does cane. I had my earning for about 3 months. That's hard to that. Sometimes out hurt so bad. You get pains all over. So I decided to go to the hospital.
Services are offered free at all of the government facility, and as such, there's usually a high demand for the service by our public. Especially when it comes to surgical specialty, patients have to wait for many months, maybe even years before very simple medical and surgical problems could be addressed.
Have you seen anyone from the thyroid? Do you ever get palpitations?
To the heart?
Yeah.
My name is Winston Outcourt. I used to be the chief photographer at the Guyana Graphic and at the Guyana Chronicle. The plus of having a surgery is that I hope that I would not have to get to the bathroom millions of times in the night, and that the pains that I would have gotten, that would have stopped. And I do hope that it will be able to make me be more mobilized. I love to do my own work. I love and crap. Love it, boy. Love it.
What I want to mention too is this. They have a strong component of nurses with them. Those nurses have been doing lectures along with the doctors, what we call continuing medical education.
amazing, the juxtaposition between some very, very nice places.
We've been tackling kidney stones, kidney tumors, prostate problems, and some of the more difficult cases that the practitioners here may not have extensive experience with.
We're going to do our best to do everything through the penis. Get the stone out. You have a catheter when you wake up. It may make you feel like you have to go to the bathroom. We may see some blood. Okay?
And the other guy is Mr. Corman. So we'll do Corman first.
All right, we're going to get you fixed up.
Emergency trauma. Kid was kicked by a horse.
You were telling me of a special case of a young man who was kicked by a horse.
While the team was here, they were able to intervene and working along with the local surgeons where he's recovering. And he's being visited regularly by the team.
All right, let me thank you very much.
I was on the horses, and the horse hit me. I didn't breathe in, and I started fighting for my breath.
There was a guy that saved you. Is there anything that you want to say to him?
Yeah, I would like to thank him for doing what he do. I'm thanking him for me mother too, and my father, and my whole family too.
Take a look. See that your stomach? Is that okay? Okay. And I think everything's going to heal up, and you're going to be just fine. Okay? There's no more horses. Anytime, okay? I'll come check on you later, okay? All right. You be good.
20 cc or bigger material is very range. You can get the clots on.
You get better much faster. But this looks good. Be good, okay?
It's fun for me. I like to teach. That's why I'm at GW. You know, I like the interaction with people who are interested.
I think we complemented each other well. I learned a whole lot. And I think from their end, I got a sense that they were able to appreciate some of the constraints and limitations for which we were, you know, forced to work.
Lifted anything like that for 1 month. All right. I love you, Ajab. All right. Thank you.
And we've been operating with the practitioners here with the goal to allow them to do these procedures once we leave. And we hope we're making our wish list and their wish list of instruments so that we can arrange another trip. We hope this won't be the last trip.
Dr. Phillips, thank you very much.
Thank you for having us.